my name is Cynthia Vidone. I'm a medical student at the Warren Alpert Medical School of Brown University. In today's video, I'll be answering some of the common questions that I've received in the clinic regarding high blood pressure. So blood pressure is the amount of force that pushes against the walls of your arteries as blood flows through them. It's read as two numbers. So the top number is called systolic blood pressure, and that's the amount of pressure occurring when the heart beats. The bottom number is called diastolic pressure, and that's the amount of pressure that's occurring when the heart is filling with blood right before it pumps it throughout the body. So normal blood pressure is less than 120/80. Pre-hypertension, which means someone's at risk for developing high blood pressure in the future, is 120/139/80/89. Stage 1 hypertension is 140/159/90/99. Stage 2 hypertension is anything over 160/100. So high blood pressure occurs when the blood flowing through the arteries is under greater than normal pressure. This actually causes the heart to have to pump more forcefully to overcome that pressure or that resistance in the arteries to deliver the blood throughout the body. So if you think of water flowing from a faucet, when nothing is obstructing it, it has a very smooth flow. However, when there's resistance, like putting your finger over the nozzle, the water flow is under a lot more pressure as it exits. There are two types of high blood pressure. The first is called essential hypertension, and about 95% of people who have hypertension or high blood pressure have essential hypertension. And basically this means that there's no single exact cause for having high blood pressure. The second type is secondary hypertension. This means that there is an identifiable cause for having the high blood pressure. For example, chronic kidney disease. That would be a cause of secondary hypertension. There are a lot of different factors that play a role in developing high blood pressure. For example, smoking, being overweight, not getting enough exercise, having too much salt in the diet, having a family history of high blood pressure, chronic kidney disease, adrenal disease, or even thyroid disease could all lead to high blood pressure. Some medications also cause high blood pressure. For example, birth control pills, or non-steroidal anti-inflammatory drugs, or NSAIDs, such as naproxen or ibuprofen, and even steroids like prednisone. Having uncontrolled high blood pressure for a long period of time could lead to organ damage, and the organs that are most typically affected by high blood pressure are the heart, the kidneys, the eyes, and it could also cause a stroke. Well, patients without diabetes or chronic kidney disease should aim for a blood pressure of less than 140/90. However, patients with diabetes or chronic kidney disease should aim for a pressure less than 130/80. That's a great question. If someone has prehypertension, which was that group of people who are at risk for developing high blood pressure, they could modify their diet and add exercise to control their high blood pressure. But once a patient has stage 1 or stage 2 hypertension, your doctor will use medication to help control the high blood pressure. We recommend that patients with high blood pressure, either stage 1 or stage 2, use a combination of medication, diet modification, and exercise to help control their high blood pressure. Home blood pressure monitoring is a good idea. Patients can take their blood pressure twice a day for a week and get a total of 14 blood pressure readings. Having this information is more accurate than just having your blood pressure tested in the office. However, with the home blood pressure monitor, the goals for high blood pressure control are slightly different. For patients without diabetes or chronic kidney disease, their blood pressure goal with the home blood pressure monitor should be less than 135/85. However, in patients with diabetes or chronic kidney disease, their blood pressure goal should be less than 125/75.